Hello, my name is Patricia and I'm a sonographer and owner of this practice. This is a primary care practice where we use ultrasound to evaluate a pregnancy at all stages from 7 weeks to full term. To carry out any scan, there must be a full consent from the pregnant lady and a clear indication by the midwife. Obstetric ultrasound is not only important to assess the pregnancy, but it also allows parents-to-be to meet their baby for the first time. With this, they can form a bond which can strengthen parent-baby connection, especially for the parent who isn't carrying the baby.
An ultrasound can be made at multiple times of the pregnancy. Usually, women visit Patricia at around 7 weeks, 13 weeks and 20 weeks of the pregnancy. The 7-week ultrasound is used to confirm the pregnancy and to demonstrate a heartbeat. It may be possible or even necessary to perform the ultrasound examination from inside the vagina instead of on the abdomen. Between 9 and 12 weeks, the fetus has grown large enough to perform the first measurements. The date of birth can be estimated based on the length from crown to rump. It can still be necessary to perform this ultrasound through the vagina when the uterus is not good enough accessible via the abdomen. This woman is in the 20th week of her pregnancy. Now, more biometrical measurements can be made to monitor the growth of the fetus. Also, the fetal heart can be examined and checked on certain congenital abnormalities. Eventually, at 36 weeks of the pregnancy, an ultrasound can be performed to check whether the fetus is indeed facing downwards. Additional ultrasound examinations can be performed on request of the future parents. For example, if they want to know the gender of the fetus, or if they want an impression of the child-to-be in 3 or even 4 dimensions.
In the upcoming case, we will show you a pregnant lady who visits the practice for her 20-week ultrasound scan. We will demonstrate this and ask you to think about how we might obtain the most accurate information to evaluate the fetal heart.